Hello, and welcome. Rick Bukata, Risk Management Monthly, coming to you for the month of October, that is. We have on the broadcast this month a special guest who I'll introduce in a second. We've got Mike Ritter, who's been on multiple times in the past, and in fact introduced us to our special guest. Kevin Klauer will be joining us in a bit. But in the meantime, let me introduce you to Robert Tyson. Robert is a strategic managing partner of Tyson and Menendez. I hope
Men,
I probably
Mendez.
got that screwed that up. But in any case, uh, he's his specialty is teaching lawyers and his partners. He has 21 offices in 21 states. Um, how to sense where there may be mega verdicts coming and how to avert them. And it's really very interesting the strategy that he's using, and I think a lot of it has uh, rubs off on how emergency physicians can participate in trials and not not make it so that it's going to be a lot worse than it has to be. Welcome, Robert. Appreciate your taking your time.
Thank you, Rick.
Robert's from San Diego. I'm in Los Angeles. Mike's in Mission Viejo, and Kevin will be coming in from Ocala, Florida. And so, why don't we get started? A little bit about your background. I mentioned Villanova, and I think in the past, Villanova, um, 30-year career. You apparently had this groundbreaking course in which you basically said the insurance companies have to pay what you can't win based on or get compensated for what the bill was, but you have to get compensated for what was paid for that bill. Which basically, we all know in medicine, there's a big difference between what's billed and what's paid. And this was a landmark ruling estimated to be worth about $10 billion a year. So I think that in the book, you wrote a book, 2002. Oh, look at that. Yeah, it looks like what people do when they're doing their YouTube. They show their YouTube plaque back there, just to make sure you understand. So that's Bob's book. It's 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 giving the secret sauce that his firm basically developed, he in particular, on strategies to limit mega awards and the likelihood of mega awards. And I think that that's one of the things that we want to talk about today. So, Bob, welcome. Thanks very much for taking the time.
Thank you, Rick. Appreciate being here. Thank you.
Mike and I came up with a few areas of question that we would like to hit you up with. Mike, do you want to start?
Sure. I just got back from the ASHRM conference, which is the American Society for Healthcare Risk Managers. And they actually gave, I'll just cover this real quick, but they gave from 2020, these are all med mal cases that are closed. And they said there were 22 cases that were closed between 10 and 15 million. There were 10 cases that were 15 to 20 million, and then 6 cases that were more than $20 million for the year 2020. And they felt that most of the big cases had been closed out. So, the take-home message is that we're seeing an increase in these gigantic verdicts. And one of the reasons that we reached out to Bob is his book, Nuclear Verdicts, deals with this. So why don't you tell us a little bit about your book and how you came to be where you are with it?
Yeah, thanks, Mike. So it wasn't my idea. I had a management consultant who worked with us in the firm, and he had suggested, and he wrote a few books, and he's since passed away. Great guy, Mort Shavitz is his name, and he had said, because we're trying to be the best defense firm in America, and we're teaching our lawyers. And I believe that, first of all, I know there's a pattern to nuclear verdicts, and I know what we can do to stop nuclear verdicts. And so I had been teaching that in the firm. We had trainers of trainers in this whole program. And at some point, Dr. Shavitz recommended that, why don't you share this with the world? Well, as I had mentioned to Rick earlier, we defense lawyers don't share anything with each other. We very, very little. We talk about it. We make some friendships with some other lawyers where we'll share stuff, but we don't really share anything. So this is the first book ever written for the defense. All the books that you see out there are written for plaintiffs' lawyers, how they can get more money, right? Because they all, plaintiffs' lawyers are paid very differently than us, right? They're only paid if they win. I get paid by the hour, right? I get paid win or lose. I get paid the same for giving a closing argument in a $50 million med mal case as I do for summarizing discovery responses. I get paid the same exact amount. So there's very different motivation between us. And when I shared with my partners at the time, the book came out just before the pandemic, February 2020, or right at the same time as the pandemic. And I had, a year before that, shared it with the partnership. And if I'd put up for a vote, it would have been voted down. Why are you giving away the secrets? Why are you giving away the secret sauce? You're giving it to your competition every which way. You're giving it to plaintiffs' lawyers, who are your direct competition, and you're giving it to other defense lawyers, right? We're all fighting for the same clients, the same insurance companies, the same corporations. You're giving away the secrets. And besides that, no one's ever done it before. Like, why are we going to do it if no one else has ever done it before? And what I just said to him is two things. First of all, who are clients going to hire? They're going to hire someone who read the book or someone who wrote the book, right? Like, why not go with the folks that wrote the book? And then the second thing is, at some point, like, why'd you go to law school? Like, this stuff isn't fair. A nuclear verdict, by definition, is unfair. It is not just. And I'm not saying the only reason any lawyer becomes a lawyer is for justice, but it plays a part in it, and maybe the older you get, the further away you get from those ideals, maybe in some cases. But at some point, these results that we're talking about, and today we're going to focus on doctors and ER doctors, but in general, they're not fair. They're not just. So, and the book is done very, very well. It's been an Amazon #1 bestseller. Insurance companies have bought it by the hundreds. Insurance companies have bought it by the thousands. I've spoken to almost 20,000 people, defense lawyers and insurance folks and risk managers, just since the book has come out. So the interesting thing is, Mike just pointed out, though, not only has the book not stopped nuclear verdicts have gotten worse since the book has come out. So we have to do more. So getting the word out here, I appreciate you guys having me on.
Bob, I saw, the verdicts that Mike mentioned are the 10 to 20 millions. I saw this verdict for 460 million for two Edison employees when they were basically squeezed out of their jobs after allegedly complaining about sexual harassment and racial harassment over a chronic period of time that was never acted upon during the 17 years or so that these people worked with the company. And it was 460 million. And that is, if that's not a nuclear verdict, I don't know what is. That there's nothing like that in emergency medicine. We'd really have to work hard to do 460 million. And it was only two people, it was with a very affluent company.
Yeah, it's so, the definition of a nuclear verdict that's commonly used is when a verdict is $10 million or more. So for like research purposes, if you're looking at data, that's typically your cutoff. The more accurate definition is where kind of the verdict shocks the conscience, or the non-economic damages are disproportionate to the economic damages. So in other words, you could have $1 million nuclear verdict. Let's say it was an injured plaintiff and they just sought chiropractic care and it was $20,000 over a couple of years. And the award ends up being $1 million. 980,000 of it is in pain and suffering. Well, that's definitely a nuclear verdict, right? So it's where the pain and suffering, the non-economic damages, is disproportionate to the economic damages. You also have punitive damages, but the largest component of most nuclear verdicts is the non-economic damages.
How does this business of caps come in here and doesn't seem to stop them?
Well, listen, money is an amazing motivator. So what happens is when you have tort reform, like we had generally in Florida just this year, and you have in Iowa, specifically to medical caps, like we've had in California for 50 years, just recently revised. When you have changes in the law that impacts your compensation, you're going to try to get around that, right? Everyone gets all excited, like especially with Florida, all the tort reform that just happened down there in general, not just for doctors. Everyone's all excited, but they're already working on ways around it. You mentioned the seminal case that we handled, Howell versus Hamilton Meats, where you're only allowed to recover what's paid, not the much bigger amount that's billed, which at the time, this is 12 years ago, was estimated to be $10 billion a year. Who knows what it is this year? That difference between what's billed and what's paid in litigation and all claims, just in California. But they've been trying for the last 12 years to get around it. So what you're finding where there are caps is the things that are making it to trial in the medical arena are the ones where they can get large economic damages, very typically in future life care plans, right? That's what they're really trying to drum up, is the medical expenses, and get life care plans that are $10 million, $15 million or more. The bad baby cases and other where you have just a big life care plan, because they're not typically capped, right? And that makes sense, right? Someone's seriously injured, you want all their medical needs to be taken care of. So that's where they've kind of shifted, getting these outrageous life care plans.
Is that a matter of your experts determining what they think it should be, and their experts determining, and you're arguing between experts?
That's exactly what it is, Rick. And they're putting up these big $15 million life care plans, let's say, and ours might be $2 million. And then they claim that we're asking for a discount and we're the ones who did the harm. And they'll use, first of all, we can step back at some point and talk about what's going on in general with juries and plaintiff lawyers. But just an example, just so your folks out there know what's going on. Like, they are going to say, when you have a life care plan of 2 million and they have one of 15 million, they're going to say, we're asking for a discount. And they're going to say, when you break something, you have to fix it. And the person who broke it doesn't get to name the price, right? That's their shtick. And they're using stuff like that all across the country to make it seem like we're trying to be unfair to a plaintiff, right? Like we might be saying they don't need care while they're asleep, and they're saying they should have somebody just sitting there, 24/7.
Mm-hmm.
So there's just one example of how you can start to have the plan differ times the next 30 years or 40 years, right?
Yeah, I guess in medicine, is that the only area where you can get a nuclear verdict, where there's a claim of how long and how life expectancy and the care that's going to be needed, and that there's no places for, at least in medical malpractice, punitive damages? That doesn't come up in medical malpractice, does it?
Not where there are not where there are caps and tort reform. It can definitely happen in states where you don't have that, right? And can happen pretty often. So without tort reform, punitive damages are definitely in play, can happen without these caps. But in general, punitive damages, they can be in play, but they're not the main concern. No.
Gotcha.
Yeah.
How do you get the jury, or how does the plaintiff's attorney get the jury wound up to the point where they want to give a punitive ratio of 1,000 to 1 or some gigantic excess compared to what the actual damages are?
Yeah, and that's a good point, Mike. Even though punitive damages may not be recoverable, the juries are essentially punishing through their non-economic damage awards, as Mike just pointed out, right? It's 1,000 to 1 or 500 to 1 when we're often doing valuations, and our valuations are rather complex, and we do a lot of jury verdict research. But if someone's got 100,000 in meds, you're typically thinking 2 to 3 times meds. 1, 2, 3 times meds might be the value of the case, right? Got 100,000 meds, maybe the whole case is worth 400,000. But as Mike says, now it can be 50 to 1, right? It could be $5 million or $50 million. So, you have to look at that. But to get into the nitty gritty so that, your doctors out there know what's happening, I will say this isn't peculiar to just you. There are several industries that are getting hit with nuclear verdicts. Trucking, transportation is just getting slayed right now with nuclear verdicts. School districts, public entities, governmental entities getting killed. Corporations in general, right, are getting killed, and the medical field is getting killed. And so I think if we can step back to answer your question, Mike, about what are plaintiffs' lawyers doing, they've changed the way that they try lawsuits so that your folks understand that about almost 15 years ago, you saw a big shift in how they try lawsuits, and they changed the way they try lawsuits in two major ways. This is stuff just within the courthouse itself. Like, I'm not talking tort reform or attorney advertising or litigation funding. Like, there's a lot of things that go into nuclear verdicts, and but the two major shifts that happened in a courthouse about 15 years ago is, first, and this is from plaintiffs, first, they've changed the emotion they're going for. They used to go for sympathy. The first half of my career, it was always sympathy. You're always worried about the plaintiff. Is the plaintiff going to be in a wheelchair? Is the plaintiff even going to be able to show up? Are they going to do a life in the day video where everyone's going to be crying because this plaintiff can't get out of bed and they have to be fed, and whatever it might be? And you're always worried about that. That's changed about 15 years ago. They're now going for anger. They're going for anger. So they're going for the emotion of anger. And they're trying to get them angry at our doctors, at our hospitals, at our defendants. So the focus now, starting about 15 years ago, was from sympathy and focus on the plaintiff. And they'll take that. They'll still take sympathy, right? But the focus now is all on us, on our clients, on the defendants, and trying to get them angry at us. And that's the entire focus. Now, what really crystallized that for them was a book that came out in 2009, which is called The Reptile Theory. And if you're involved in this litigation, you've probably heard the reptile theory. And it was written by a guy named David Ball and Don Keenan. David Ball, he wrote the Bible on damages. It's called Ball on Damages. And like I said earlier, all these books are written for plaintiffs on how they can get more money. Now, he did this seminal book in 2009, and all defense lawyers have heard of it. But it's just one means to get them angry. So they use this reptile theory, many of them. We're studying nuclear verdicts for book number 2, and we have 100 nuclear verdicts where we have the closing arguments and the trial transcripts. So we're able to do a deep dive into what happened in over 100 jury trials where there were nuclear verdicts. and over 70% of them use the reptile theory, which is a little bit frightening because the reptile theory is illegal. It's you're not allowed to do it. He has a third of his book is devoted to how to get around the laws of our 50 states. So it's illegal in every state, but they're still doing it 15 years later. Going for anger. And then the second thing, major change that plaintiffs' lawyers are doing in jury trials is they're asking for big damage awards. They're giving big numbers. It used to be in the beginning of my career and for all of time that they didn't ask for big numbers. They thought it would be off-putting to a jury to ask for a big number. Like they'd seem like greedy plaintiff lawyers. Seem like that. And what they realized is they studied the psychology of priming and recency. And they realized that the best way to get a big jury verdict is to ask for it. So almost no nuclear verdict happens without them asking for a big number. And that's a radical change because before 15 years ago, you weren't seeing as many nuclear verdicts. They weren't asking for them. And if you think about it, really, what normal American wakes up, tells their spouse, hey, I'm going to jury duty today. I'll probably award 20 or $30 million, but I'll be home for dinner. Nobody in their right mind wakes up thinking anything's worth that. The way it happens is plaintiffs' lawyers use this psychology and start priming them while they're picking a jury and finding out who in the jury would have a problem without knowing anything yet of awarding, say, $40 million. And then anyone who says they have a problem awarding that, they try to get them out for cause so that they're not sitting on the jury, right? So they start priming and then recency. Then they're working in their number each day. They try to get their number in each day, and then they do it in closing. So two major changes that has affected all of tort law, going for anger and asking for big numbers. And that's present in almost every single nuclear verdict that we've studied. And the good news that I take from it, and I'll stop talking here in a second. The good news I take from it is, okay, we know what they're doing. And we don't have to write our congressman to stop it. We just have to do some things differently. And change is hard. Change is hard, especially in your guys' space, in the medical malpractice space. You guys have had tremendous success forever. And now that's changing.
Well, when you say it's changing, it's at least I heard that our number of suits are going down, but the awards are going higher.
Right. Severity. Yes. And I think that there's study after study on that that shows the severity in the medical malpractice arena is going up.
What do you do in terms of trying to prevent or mitigate what you know is going to be happening?
So you have to change your approach to defending jury trials. And a lot of doctors don't want to do that. A lot of medical institutions don't want to do that. A lot of defendants don't want to do that. A lot of defense lawyers don't want to do it. You've had great success. But the reality is they figured it out. They want you to do whatever you've been doing your whole career. Whatever you've been doing, you've been winning, you've been getting doctors off, you've been getting defense verdicts, whatever you've been doing, they have created a new approach to jury trials that assumes you're going to do the same thing you've always done. They want you to do it. And for the large part, we play right into their hands. We do exactly what we've always done because it's worked. The problem is when it doesn't work, you're getting killed now. Like these awards are crazy, that they're just crazy. So you gotta do some different stuff. And we have the ideas, we have the methods, we have the solutions. It's just, part of it's change, part of it's doing things differently. If change was easy, I'd be a lot thinner, it's hard change. So we need folks to change what they're doing and to understand what's going on.
Well, acknowledging that you understand that they're going to be going for anger, what is the plan to diffuse the anticipated anger?
Wow. So Rick, you hit the nail on the head right there. Let me give you some insight to how these cases work, right? Like, just think about it. We're strategizing. We're now a couple months away from trial, and you have all the stakeholders in a room. It used to be in a room, now it's in a Zoom probably. And you've got insurance people from New York or Connecticut on the line. You may have brokers on the line for a big hospital group. You're going to have the hospital group there. You're going to have all these stakeholders. You may have excess insurers on there, right? And normally, when you have this meeting and you're strategizing for trial with the doctors and everyone else, the question gets asked of the defense lawyer, hey, how are you going to win this thing? And the typical response is, oh, we're going to fight everything. We're going to fight everything. We have incredible doctors lined up, all of whom are going to say, we met the standard of care. Let me tell you, we've got Dr. So-and-so, who's a renowned expert and, defendant, insured, our client. You know who he is. He's in Miami, and you actually recommended him. Oh, he's one of the greatest ever. He's going to say you met the applicable standard of care. We're also going to have Joe Blow from, wherever it might be. Mayo Clinic going to come in here and testify, and we're paying him $1,500 an hour. He's fantastic. He's going to say he met the standard of care. Okay. That's the typical approach. Like, okay, we're going to deny. And we've got great people that are going to come in and say you're wrong. But Rick, you have to change. You have to do exactly what you said, because the world has changed. So now when you're in that group with these high-powered people and you're preparing your strategy with your doctors and with all the claims people, the brokers, the excess insurance, risk managers, all these folks, you got to change the way you're looking at it, because you now know, they're going for anger. When somebody's angry and you deny them, when somebody's angry and you tell them you're wrong,
Makes you more angry.
Yes. And that's what we do. Here's what happens. I mean, listen, everyone likes to say, oh, society's all screwed up with these nuclear verdicts. Let me give you some insight to nuclear verdicts are delivered by your neighbors. We're not shipping these people in from La La Land, right? They're your neighbors. Now, your neighbors are getting manipulated. I believe they're getting manipulated by plaintiff lawyers who are hijacking justice. But justice doesn't just happen. You have to fight for justice. That's the way we're set up. I don't get to go to court and just watch justice. That'd be cool. I'm going to go to court and let's see justice happen. No, you have to fight for it. We're not fighting the fight. So think about it. Your doctors that are listening have to put yourselves in the courtroom. And what's going to happen if plaintiff's lawyer has done his or her job decently? When they're done with their opening statement, first of all, they got 12 people who can all agree that if the evidence supports it, they can award $40 million, right? They've all agreed to that. What the hell? Okay. Then now they do their opening. When they're done with their opening, if they've done a decent job, they've left you, your defense lawyer, 12 people who are probably on the verge of anger. They haven't really heard your story. They haven't heard all the experts you're going to bring in and how you met the standard of care yet. But just having heard that story, if plaintiff's counsel has done a decent job with opening, you've got 12 people that are on the verge of anger. If you've got a great plaintiff's lawyer, you've got 12 angry people. When you stand up and just deny, and tell them that you're going to bring in all these people to say that you're wrong and those feelings you have are wrong, you're screwed. So you have to change your mind thought. And your doctors need to know that. Your doctors need to be asking the question that Rick just asked that we never spoke about, but he got it right. It's okay, how are you going to win this case? We're going to diffuse anger. Okay. So what does that mean? Well, first of all, you have to figure out what's going to get a jury angry about your case. And that's not always so comfortable to do, right? Because very often we don't feel like we did anything wrong. And And to say that in a group of high-powered, insurance and risk managers and doctors, to say what's going to get a jury kind of feels a little weak. It feels like you don't believe in your case. But that's the exercise you have to do. Let's make a list of all the things that we think might get a jury angry about this case. Let's list them out. And what you'll find is sometimes people say, first of all, sometimes people don't have anything. I don't think they should be angry about anything. All right, well, you're obviously not getting to know your competition here and understand what they're going to do to you. But the best you can hope for is, people will chime in and say, well, they may be angry because, I ended my shift early, but so-and-so says that I met the app. All right, no buts. You just have to have a brainstorm where you list all the things that may get a jury angry. And then you have to figure out, to win, how are we going to diffuse the anger? Because what's happening is you're doing the same thing you always did. You're having professionals come in, say you met the standard of care, and juries don't care. Like, I get it. We feel good about it, right? I've been doing this for over 30 years. I've got Dr. Renowned so-and-so expert who says we met the applicable standard of care. That should be enough. That's always been enough. It's not enough for angry people. It's not enough. So you have to figure out how you're going to diffuse that anger. That's the first thing you have to do.
And Mike, I don't want to, just be.
I was going to ask, what advice do you give to the doctors in terms of their behavior in the courtroom to make them more likable? For example, some of the things that I've learned is dressing proper, professional, but not flashy. You're not wearing your gold Rolex or, crazy jewelry, that sort of thing. That you're never looking at your phone while you're anywhere near the courtroom. You should just leave it in the glove box of your car when you arrive at the courthouse and don't look at it until you're done. Always bring a medical journal with you. So when you're on a break, you're sitting out in the hallway and the jury's walking by, you're reading your medical journal. They'll think you're smart, trying to keep up on everything. Smile a lot. You want to be perceived as, you want the jury to look at you and say, I'd like that person to be my doctor. I like their demeanor. They seem like they care, that they're nice. You have to smile. You've got to explain what you did. And you need to be present during the trial. You can't be missing the trial. You've got to be there and be engaged. And what else do you have to add to that kind of lineup of things?
That's pretty exhaustive. I agree with everything you just said. Being present, of course, being the most important one. I know doctors are busy, and these trials typically take at least weeks, if not more than a month. And, we'll hear it. Hey, can you explain to him that I do surgeries on Tuesdays and Thursdays? If you want me to, you find that impressive. What about the people that have jobs on Tuesdays and Thursdays and aren't getting paid at all, that are sitting there deciding your fate?
Right.
It doesn't go over as well as you think it may. So being present is the biggest one. And it's really, really important that you be there every day. I mean, I've had doctors show up, in their work gear, and you can tell, all right, they're working that morning. All right, I get it. There's certain stuff you're not going to be able to avoid, right? That you're just going to have to do that surgery or be at the hospital for whatever reason. And you're going to get most of the juries that will understand that, but you really have to be present is the first one. The other stuff is everything you just said, Mike. The goal is for them to like you. It just is. You want them to like you. And remember that when you're on the stand too. It is a popularity contest. And you have to concede things that are concedable, if that's a word. Right? Like, don't fight everything. Don't fight everything. Fight the important stuff. Try to do it in a way where you're confident but not self-defense. You're not defensive. And concede what you can concede, but be firm, be strong, be confident, answer questions directly. Do not stoop to their level. Know that they're going to try to get you angry. I mean, that's their goal. And if you give in to that, then they've won. Even though you think you made your point by raising your voice, you didn't. The jury's just seeing you raise your voice, and they're not really listening to your point. So I would agree with all that. Everything you said, Mike.
Yeah, and that whole point about not getting mad, you have to understand that they're trying to use our brain stems to evoke these primal responses for both the jury and for the defendant. So when you're up there on the stand, you need to just keep your calm. And I think if you understand that's the goal of it, it makes it a little bit easier to remember the importance of your behavior, to remain professional and calm and explain, what you did. And your attorney, of course, will help you with all that, but your behavior is really key in this.
Yeah, I mean, the best witnesses are the ones that can kind of take it and deflect it and say, I understand your point, counsel. I'm just trying to explain to you that in this situation, that's not accurate. What happened here, or what happened that day, was the following, as opposed to, no, you're wrong. It's just like you're taking it and then you're deflecting it and going in the direction you want to go, the way you want to bring the testimony. And if you can just remember when you go up there, like, you just want to remain calm. Like you want to. Now with the other thing you have to remember is when you're being cross-examined, you're not going to be able to make all your points. So don't get frustrated that like your side of the story hasn't come out. We're going to get to ask you questions. Your side of the story will come out. So don't get frustrated by the fact that they're only getting half the story. That's their goal, to get you angry and only to get out their good points, right? Not our good points. So try to remain calm, for sure.
Do your expert witnesses also basically have a role in defeating this anger?
Oh yeah. So what they try to do is, plaintiffs' lawyers try to get them angry at the client. And sometimes our clients are super impressive. Sometimes our clients are easy to get angry. So they try to get them angry at the client. Then they try to get them angry at our experts, and then they try to get them angry at us. I haven't had a trial in about 15 years where they haven't attacked me in closing arguments. So that's what they do. They're trying to get the jury emotional, even though the number one rule of a jury trial is you must not allow bias, sympathy, or prejudice to enter into your deliberations. That's all they're trying to do. They're trying to get the jury biased against us. I mean, that's all. And they'll do it now they've shifted to anger. They used to have bias against us through sympathy. So that's their goal. And so yes, experts, the clients, and us, they're trying to get them angry.
Well,
Are you
Mike
able
had
to
mentioned.
educate Are you able to educate the jury at all about this sort of tactic without kind of crossing a line? What you're saying, that they're inflamed and.
Oh yeah. And you do that by, citing the law I just cited. It's a jury instruction they get. And then I'll challenge plaintiff's counsel. He gets, in closing argument, he gets the last word. He's an officer of the court. I'm sure he'll come up here, and I would hope apologize to you for trying to get you to not follow your duties that you're all sworn to do, and to try to get you emotional. Emotion plays no part in your deliberations. Here's the law, right? So I'll challenge them for sure. You can point out what they're doing too, right? That they're trying to get you angry. Mm-hmm. But there's really four things. There's 10 things in the book, but there's four main things that are highlighted in book number 2, which are present in just about all jury verdicts. And there's 4 things that your defense lawyers can do to stop them. Now, we can talk about them, but it might be a little bit too much in the weeds to talk about legal strategies, but I'll gladly do that.
Well, I think we're interested, because the people who listen to this thing are interested in the whole risk management affair, and we're definitely concerned regarding every emergency physician out there is got behind them. They're wondering about when that suit's going to occur. They're fairly random, but every day we have some cases that kind of make us gives the heebie-jeebies a little bit. So, and statistically, we know that the more cases that you see, the more patients over time that you see, that's increases your likelihood. It's not about whether you were board certified or not, or male or female. It just doesn't matter. If you went to Harvard or it doesn't matter. The statistics say that it's just bad luck.
It's going to happen. Yeah. Yeah, that's true. Mike, did you have some? I can dive in.
No, go ahead.
Okay. So here's the four things. So remember, they're going for anger. And so to get someone who's angry to listen, because think about it, if someone's super angry, like yelling and screaming angry, if you've been in a dispute with someone, they really can't hear what you're saying. Like they physically, like they almost shut down. They can't physically hear what you're saying because they're that angry, right? You see it in like cartoons, they're like blowing a top, right? So to get an angry person to listen to you, you have to first validate that emotion. You have to validate that emotion so that they'll listen to you. Like, and you don't have to agree with them. You don't have to agree that they're right. But you need to validate that emotion so you can ratchet down the anger and then shift over to having a reasonable discussion about what happened here. And you don't necessarily agree. Like, you don't say, you're right? I shouldn't have cut you off. No, not when they rear-ended you, right? Like, no, but you want them to calm down. You have to validate that emotion that they're experiencing. And so in a courtroom, the best way that we found to validate the emotion of anger is through accepting responsibility. Now, accepting responsibility does not mean liability necessarily, right? There's three different ways to accept responsibility. The first is when you have no liability. The second is when you have partial liability. And the third is when you have full liability. So there's three different baskets. It's in the book. So if you're going for a defense verdict, what you would do is you'd accept responsibility for what you did, right? You accept responsibility for what you did and you stand by it. Look, we made some decisions that night under a very pressure-filled circumstance with a lot of people in the room, a lot of blood, and we made the best decisions we could make. And we stand by those decisions. And you're going to hear about, you're going to hear from some other folks that we're going to bring in. They're going to talk about how our decisions were reasonable at that time, that we had several options, but we chose, the best option at that time. And we accept responsibility for our actions. So that's how you would do it. Accepting responsibility when going for a defense verdict to kind of try to diffuse anger.
Bob, let me introduce you to Kevin Klauer. Kevin is a emergency physician and an attorney and good friend for 20 plus years. Kevin, I think you knew the topic we were going to be discussing, and Bob is basically the father of the nuclear verdict attack, and he is basically willing to teach other attorneys strategies to deal with anger in the courtroom. Anger diffusing is a really important part of what he's talking about, because he believes that these irrational awards are generated primarily out of the anger that is able to be created in the jury.
Yeah.
Let me see if your mic's working.
Well, let me check. Can you hear me? Can you hear me, Rick?
Yeah.
Very good. Well, Bob, very nice to meet you. And yes, catastrophic claims lead to emotion. That emotion applied at the wrong time can destroy a case. You've seen it. Others have seen it. I know that I have seen it as well. So how can we control emotions at the right time? Through a lot of coaching.
Yeah. And so we were talking about getting into weeds here a little bit. Rick, with what's happening in trials and what can be done in actual trials. And we're talking about the fact that you need to validate that emotion. And that's something that the docs should be asking their defense lawyers, like, what are we going to accept responsibility for in this case? Because if plaintiff's counsel has done his job, he's going to leave you 12 people that are angry when you stand up to give your opening. And you need to recognize and validate that emotion if you want to persuade them ultimately and win. And it's true in life. If you're dealing with an emotional person you're arguing with, like, don't get me wrong, you can yell right back at them. If you're having a fight with them, you can yell back at them. You can tell them you're wrong and deny. And you can tell them I'm going to bring in all these people who are going to say you're wrong. But you're not going to change their mindset by doing that. You're not going to win the argument. And that's what we want to do. We want to win. I don't want to just like vent, stand up there and vent like they got it all wrong. This is how it happened. No, I want to win.
That's a nice distinction. Winning versus venting.
Yeah. Winning is good. And I think knowing what the goal is winning, and knowing what each counsel is really charged to do. Plaintiff's counsel, defense counsel, they are supposed to take the facts of the case and spin it to the perspective of their client. I think clinicians really believe that this is their quote unquote day in court for the purpose of seeking truth. Now, hopefully truth comes out through the process, but that is not the intended goal. It's each side representing their client based on their best ability to do it with the witnesses they have and the facts that they have been given. So if our people know the rules, in other words, this is what the purpose is. It's not for you to be vindicated to find truth. It's for you to make sure that you participate in a solid defense and don't undermine your own defense. And a lack of emotional composure is a good way to tank your defense.
Absolutely. Yeah, Mike was talking about that. Number one goal should be to stay calm, for sure.
I'm amazed at how many people are not given the opportunity for either deposition or trial testimony preparation. I think people think, well, I can talk to people. I know my case. I don't need it. I just think that really everybody should have at least one session.
Well, that's a great point. And it goes to what we talked about earlier, Kevin, which is the whole case has shifted in the last 15 years. It used to be much more about the plaintiff and their recovery and feeling sad for them. Now the focus is on the defendant. I don't care what type of case it is. The focus is now getting the jury angry at the defendant. So you really didn't need this prep 15 years ago. The plaintiff's lawyers just look at it like, oh yeah, defendant's the doc, I can tell from his notes what his story is going to be. No. Now they're probing and sticking it to doctors so that they'll get a reaction and then get the jury inflamed. That's very different. Right.
So Bob, don't you think the better the defense that you have, the more likely they're going to go after your character and try and impugn you in front of the jury? They're going to make you look bad as opposed to going after the facts of the case. And that's what's going to get under your skin.
It's interesting because you raise a great point. Doctors can hear facts and be persuaded and make a decision and see the truth. You deal with facts every day. But a lot of people aren't that way. A lot of people who are showing up to juries, they want to be persuaded. And now some jurors may be engineers, maybe, or doctors, maybe, very rarely do you get a doctor in the jury for 3 weeks or a month. I mean, almost never. So a lot of people aren't persuaded by just facts. They're persuaded by a story. Just getting out your facts is not enough. They're persuaded by what you look like, did you get riled up at some point? Like you didn't come across as calm, cool, and collected. That's enough for them to be persuaded. And whereas doctors and a lot of other defendants are just focused on the facts, And,
Bob, you're scaring the listeners now. I know what's going to happen because you're implying that a lot of the action that comes from the jury and conversation and a judgment that they may decide upon is based on emotion. Not always based on the fact.
Yep. It's not supposed to, but that's the reality. And what I say, the number one rule is you must not allow bias, sympathy, or prejudice to enter into your deliberations. And I say, okay, but it's going to, so it might as well be on your behalf. right? So you might as well try to get emotion your way, or at least deflect the emotion they're trying to get against you. So that's kind of where we're starting to get into the weeds here a little bit, Kevin.
I think it's very
we're way in the
disarming.
weeds.
I think it's very disarming to acknowledge things that you did do that were not necessarily wrong, but so that you are not in the deny, where you just don't give an inch, and if you take that posture, it's just going to be viewed as offensive. And if you basically say, think, as you gave an example there, the place was very busy. There was blood all over the place. We did our best, and there was no malice intended, or so that people understand the picture of what was transpiring, that it was not in a environment that would allow a lot of thought and going up and looking it up in the books and those kinds of things. No, we didn't have time for that. We had to do our best at the time, and this is what we did, ladies and gentlemen of the jury.
You're right, Rick. And I think if the court, the judge, does their job and they give the appropriate jury instruction, they should set the standard as reasonableness. Were the actions of the defendant reasonable under the circumstances? So when you think about that, if someone asks you a question and life is imperfect, well, you know what? You're right. I could have thought about it that way, and that's helpful to me. But this is why my actions are reasonable. This is why I made the decision I did at that time, and I would stand behind it today. So there's a dose of humility that you offer with your answer, but you still stay firm that what you chose at the time was the right decision.
Absolutely.
Humility. The doctors have to be humble.
Yes, sir. And the jury wants to see it. They want to see it.
Yeah, I think they do. I think that, and there's, you can't wear that Armani suit, even though you have it. You got to get out your, cheap suit that day.
You can, but you're going to lose it, Rick.
Yeah, don't. Yeah, exactly. So, yeah, you can. Yeah, you have to ditch the Rolex too.
That's right.
Well, we can talk about the three other things if you want.
Yes, let's do that, because the first one was to basically acknowledge that they're going to work to make the jury angry at you. You're the lawyer. They're going to make the jury angry at the plaintiff, the defendant. They want everybody to be angry on your side, on our side of the ledger. Attorneys mean, the whole bunch of people. We got a lot of mean people here. So it's not just the docs. And Robert's basically developed the strategy and techniques to try to anticipate and diffuse anger, which he acknowledges is probably one of the major sources of the nuclear verdicts. We had talked earlier about a verdict for $460 million for two Edison workers who had been pushed out of their jobs after 17 years or so because they kept on complaining about the harassment to women and the racial tensions that had been created at the work, and $460 million.
Sounds like a lot of punitive damages there to send a message.
Send a message.
That's right.
In that message, everybody's electricity bills are going to go up. That's the message.
That's right.
It's true.
Bob, let's go to the others.
Okay. So the second thing, the first was, accept responsibility, not necessarily liability, unless you are liable. And then the second thing is to give a defense number. So we give a defense number in every single jury trial, even when going for a defense verdict, which is controversial. So is accepting responsibility. So where this comes from is because they've changed. They've studied the psychology. They know that the only way to get a big jury verdict is to ask for one, and it works. And so they're anchoring the jury up high, and studies have shown counter anchoring works, that it works both ways. So if the plaintiff asks for a big number, same set of facts. There's a study from the University of Iowa Law Review about 7 years ago, that found if plaintiff asked for $250,000 of these set of facts, they got around 200,000. When they asked for $2.5 million, they got $2 million. Same facts. It wasn't more pain, more injuries, same fact. Just by asking for more, they got more. The opposite was true. With the defense didn't give a number, the award was higher. If the defense gave a number, the award was lower. So it makes sense, right? Because psychology is the study of humans, not just plaintiff, leaning jurors. So, okay, it makes sense. Anchoring works, counter anchoring works. But here's the interesting thing. So these University of Iowa Law Review folks found that if the defense gives a number, you're more likely to get a defense verdict. And really, no one in our industry believes that. Yeah. It's counterintuitive to everyone's body of work.
But it's contrition. You're willing, and maybe you're willing to come to the table. Humility again. So Bob, let me ask you a question. So if used in the past with defense strategies on marginal cases, a high-low strategy with the plaintiff. Is this what you're talking about? You go to them in advance. All right, we know we got some weaknesses. We can speak behind this. We're not going to go above this, and here's as low as we're going to go. So we know it'll be somewhere in between, unless, we get a defense verdict. Is that what you're talking about, a high-low?
No. So high-low is used in these catastrophic cases. It'll often come up during trial, and you'll enter into a high-low settlement agreement that the jury doesn't know about. Mm-hmm. So you're entering into a settlement agreement, and if it might be, 2 million to 10 million. So if the verdict comes in at 1 million, mm-hmm. plaintiffs will get 2 million, right? So it's 2 million to 10 million. But if the award comes in at 20 million, all they get is 10 million. And the case is over. It's settled. There's no appeal. No. So what that is often used in these big cases. What I'm talking about is you stand up in front of the jury in jury selection, and you're telling them, you just heard plaintiff's counsel ask if you could award, I think he said $40 million. But let me ask you, if the evidence supported a much lower amount, say $2 million, without knowing anything about the case yet, would you feel comfortable awarding a much lower amount, say $2 million? And some jurors will raise their hand and say, oh, for my brain, I'd want more than $2 million, right? Well, now now you know. Now, if you're going for a defense verdict, you have to add a sentence or two to that when you're doing it in voir dire, jury selection, where you're saying, look, the judge read you the facts of the case. You understand that we believe the evidence will support a defense verdict, that you'll find a verdict in favor of our doctor because he met the applicable standard of care. And so we don't think you ever get to damages. But the reality in this case, you heard plaintiff's counsel, we're going to spend a couple of weeks just on damages. And even though we don't think you get there, how do you feel if the evidence supported it, awarding a much lower amount, say $2 million, and you have a discussion about it, and then you bring it up in opening? You tell them again, we don't think you get there. You may work your number in during different witnesses, and then, or you will work it in during different witnesses over the coming month, and then you bring it up in closing. What's interesting is the University of Iowa Law Review folks didn't say why you're more likely to get a defense verdict if you give a defense number. It sounds counterintuitive. The data supports it. Our experience supports it. We get defense verdicts. We give a number in every single jury trial. I've got someone in trial in my firm every single day. There's someone in trial right now. We get defense verdicts all the time while giving a number. So in addition to it being a risk play, which to me, it's like, why do I have to convince insurance companies to give a number when you're in the risk play business? But it's a risk play on the one hand, but on the other hand, there's psychology behind it. And I think it goes really close to what Kevin was saying. I think what it is if you can give a number and support it, and it's a reasonable number, it's another opportunity for your defense lawyer to seem like the most reasonable person in the room, as opposed to this $40 million ask that they're making these wild claims for. if you can make a reasonable argument for why $2 million, I'm just making up these numbers, right? $2 million is reasonable, then I think you gain credibility in your liability argument, right? They're like, oh yeah, he made sense in damages. He kind of makes sense in liability too.
So Bob, I think so the art there is making sure you don't undermine your own defense strategy while you're offering that. That's why I like the high low, because you're doing it behind the scenes, privately with plaintiff's counsel, so you protect the downside risk. But boy, I think it's a bold strategy. It's very interesting. I could see you doing it well. I could see other people failing miserably at that.
Well, Kevin, that is a great point, because the philosophy has gotten butchered. We had it when we originally wrote the book. It was pretty well. Now we wrote the book, but before we wrote the book, it was pretty simple. You give your number early and often, priming and recency. So that was it. Give it early and often. But then we had to add some things. We had to add that it can never go up. So we've had defense lawyers double their number in closing a month later, and they've gotten killed by plaintiff's lawyer, as you might imagine, right? You heard something over the last month to cause you to double your number. My number has been $40 million since day one. It's a reasonable number. And I've justified it over the last month. And these guys they've heard something. They understand their case has gone south. All right. So early, often, never goes up. Then we had to add that it has to be a reasonable number. A lot of med mal lawyers and other defense lawyers will say, oh, I give a number, I give 0. Okay. Listen, she lost her, liver or whatever, lost an arm. It's worth something. It's not worth 0, right? So the number has to be reasonable. And then the last thing, so now we've gone from 2 things just from doing this. And the early part is you don't give it for the first time in closing, because as Kevin said, you give it early and often. If you give it for the first time in closing, that's a sign of weakness. You've been going for a defense verdict for a month, and now you say, but if you get to damages, no, don't do that. The last thing is it's got to be a number. So what a lot of defense lawyers are doing now, and we're seeing it in our research of nuclear verdicts, is they're saying, I'm going to give you a number and it's going to be substantial. Okay, you're losing the psychological benefits of giving a number, right? Because what happens is, I've got one in particular, which happened in LA against Brian Panish, who's a big plaintiff's lawyer in LA, where he asked for $110 million. And this excellent defense lawyer said he's going to tell him the number and it's going to be substantial. Well, the number was substantial. It was $9.9 million. That's substantial. But not when you've been hearing $110 million for over a month. And the award was $44 million. So that was a nuclear verdict. So you got give a number. All right. Accept responsibility, give a number, personalize the defendant. When you study these nuclear verdicts and you read the closing arguments and the transcripts from them, I don't have the exact numbers yet because book number 2 hasn't come out yet, but it's well over 80% of them. When you're done reading the closing arguments, you know everything there is to know about the plaintiff. You know what she was like in high school. You know, I've had cases where they brought in the high school soccer coach for like a 44-year-old woman. Like, what the hell does that have to do with anything? You know everything about the plaintiff, and in over 80% of them, you've heard 0 about the defendant. So the defense lawyer is not telling the corporate or the doctor's story. You know, and gosh, if anyone has a good story, it's the medical field. I mean, you're there to help. Oh my God, that story has to be told, and it's not being told in nuclear verdicts. So you can talk about how you do it and what a jury wants to hear about the defendant and all that. My advice to the defense industry is just try. You know, just try. All right, I get it. Everyone knows what a hospital does. Tell them what they do in this community. You know, and ultimately, everyone feels like, oh, it's hard to defend this type of corporation or the government or insurance companies. It's tough to defend them in bad faith. All those entities come down to people. So tell a people story. Get them to know your doctor. Why do you think they're spending so much time on making this connection with the jury and the plaintiff through their parents, through their friends, through them? It's because you'll make a connection and they'll give more money. if you'll make a connection with the defendants, they're going to like you more and they're not going to give as much money. This stuff isn't rocket science, but it's not happening. And everyone likes to walk down the hall and say, people in America are nuts. The court system's nuts. No, people are being manipulated and the defense hasn't changed what it's doing.
Good point.
Last of my 4 points is argue pain and suffering. So I forget the numbers. I don't forget them. They're not finalized yet. But in over 90% of all nuclear verdicts, the defense doesn't even argue pain. Oh, no, over 70%. Over 70% of all nuclear verdicts, the defense doesn't even argue pain, suffering, non-economic damages. And again, that's typically the largest component of nuclear verdicts. And yes, punitive damages, but when punitive damages aren't in play, like you guys have been saying, and as you guys know, there's a punitive element to these compensatory damages and to the pain and suffering. And that's where it's happening. And most of the time, the defense lawyers aren't even arguing it. Like they don't argue it. And then when they do, they're not arguing it well. Like these plaintiff lawyers are telling these emotional, moving stories and wild stories, because in closing, you get a lot of leeway to get jurors thinking about big numbers. And then the defense, if they argue it, stand up and just kind of repeat the law. The law says you must be fair and reasonable. Here's jury instruction that says reasonable compensation. And we all know that $40 million is not fair and reasonable. So please go back there and award what's fair and reasonable. Well, just repeating the law with emphasis is not really an argument. Come up with something. So we have a method for arguing pain and suffering. We have 2 chapters in the book on how to do it. And it's the biggest component of nuclear verdicts, so you should at least be trying to argue it.
Do you think that all the advertising on television that we get bombarded with about all these law firms and people standing up and saying, I got $2 million for getting rear-ended and so on and so forth, desensitizes the jury pool to these large verdicts?
Absolutely. Absolutely. And, you know, one of the big problems, so look, I'm just a simple trial lawyer. So I'm just focused on what's happening in the courtroom, and they're being manipulated, and there's things we can do. If you look outside the courtroom, yes, there's a lot of things going on, right? There's a lot of litigation funding behind the scenes, attorney advertising. I mean, these attorneys are taking, they have this reasonable settlement. They could put money in their pocket, but they know that if they can get a $10 million, $20 million award, whatever it might be, they're going to sell the crap out of that on billboards and social media, and they stand to get a whole bunch more cases. So even though they could have had $1 million in settlement, they'd rather take the chance on selling these big ones. And I'll tell you the real problem with our story and the problem with nuclear verdicts from our point of view is our reason for why they're unfair doesn't fit on a bumper sticker. Doesn't fit on a bumper sticker. Plaintiffs' lawyers fit on a bumper sticker. I mean, I was in Vegas last weekend for my son's basketball tournament. Every billboard is injured, get money, hurt, get paid. I mean, their whole thing fits on a bumper sticker. And that's our attention span now, for better or for worse. So to explain how all the negative things that come from a nuclear verdict and how it might impact them, we don't process that. It's not as moving as, oh, I can get paid. Oh, I can get $2 million. Oh, I want that. That's our America.
It does seem like the lottery. I won X million dollars kind of thing.
Mm-hmm.
I think it's all very, very interesting. It's what you've told us is our nuances and that we are really not aware of at all. We just basically know, try to be a nice guy on the stand. Don't lose it. And all of that, it seems very reasonable and intuitive, but there's a whole strategy going on behalf of good defense lawyers to try to show that there was a whole series of events that occurred that should make this not worth this ridiculous amount of money that is being asked by the other side. it is kind of amazing that some of these awards are that the jury can actually feel that voting these awards are reasonable. I mean, the lawyers that voted that got these people to give $460 million for these two defendants. I mean, two
Plaintiffs, yeah.
employees. It's artful lawyering.
And it's manipulation. But Rick, you have to be careful going back to the whole doesn't fit on a bumper sticker. Like when I post stuff on LinkedIn, I often don't even like really give my opinion. I had a defense lawyer challenging me. Do you think that the verdict was unfair or that the treatment of the plaintiff was unfair? And I'm like, by definition, a nuclear verdict is unfair. But I don't feel like debating even. I'm just like, why is this coming from a defense lawyer? You have a whole bunch of plaintiffs lawyers trolling you, right? Like, what if it was your daughter or what if it was your mom or whatever? It's just like, all right, dude, whatever. I'm not getting into this with you.
Well,
but that's the other thing. Our stuff doesn't fit on a bumper sticker. Look, I've had plenty of opportunities to do point counterpoint, right? The book came out, very popular, Amazon #1 bestseller. You can go on, different TV stations and talk about a nuclear verdict. Sounds great. The problem is plaintiff's lawyer's response to me is, I've got one question, Mr. Tyson, explain what do you think about this? Well, it doesn't really sound fair. Sounds like they were manipulated, whatever it might be. I say, right? Plaintiff's lawyer, oh, now let's cut over to so-and-so, expert plaintiff lawyer. What's your point of this? I've got one question for Mr. Tyson. Mr. Tyson, how much would you take to give up your daughter, or give up her life? How much would you take? All right, well, let's cut to break. Thank you, Mr. Tyson. Scumbag, excuse my language, but it doesn't fit. It doesn't just fit. So I'll share with you guys. We're working on a documentary. I haven't told anyone this yet. So we're working on a documentary to reveal the underbelly of nuclear verdicts, because our story does work over an hour, a couple of hours, because there's a lot of stuff going on. Plaintiffs are being manipulated. Not everyone's getting $2 million. The award's $2 million, but by the time you pay all these experts and pay the plaintiffs' lawyers, they're getting almost nothing. And that's never told. So there's a lot there. We've got some interest in a documentary, which I think would really help. We'll see.
Well,
nuclear
Bob,
documentary.
Pardon me?
The nuclear documentary. It's
Nuclear
coming.
documentary. Exactly.
thanks so much for letting us in on the secret sauce of how you deal with trying to diffuse the likelihood of nuclear verdicts. Mike, do you have any final comments or questions?
Just one thing, just from the ASHRM conference last week, and that is, and I think I shared this in an email, radiology is having a mass exodus. A lot of radiologists are retiring. So I had lunch with a couple of guys that underwrite reinsurance policies. They sell a bunch of tails and then they get bundled together and a company buys them. Normally, radiology represents about 3% of the tails that are written every year for doctors that are leaving. In the last 12 months, it's represented 35% of all the tails written. And they price them differently if it's a retirement versus changing jobs. And 90% of them are retirements of the people that are buying tails in radiology. So they're just getting fed up. And so the workload is going up for radiologists, which means they're reading films faster. There's going to be more misses, more lawsuits. It's really going to be a spiral. And there's no easy answer because there's not a conveyor belt out there that we can turn up to crank out more radiologists to backfill this exodus.
Although it's kind of interesting where you talk about artificial intelligence, radiology tends to be pattern recognition. And pattern recognition is one of the easiest things to teach these machines to do. I mean, in terms of breast calcifications and all of those kinds of things, or reading chest x-rays and the like. But it seems like a lot of physicians are leaving the practice, although I have no idea what they're going to do for income unless they've already made enough to survive on, because they don't know how to do anything else. Bob, thanks so much for taking the time with us. I really do appreciate it. I also enjoyed our prior conversation, getting to know you a little bit better. And Kevin, thank you for. It looks like you're very formally today. You looks like you're working today.
I am working every single day, Rick, but today was a little more formal than the average for sure. But thanks
Yeah,
for noticing.
yes. Thank you all. I appreciate it, and look forward to talking to you again. I hope that this isn't the last time we talk, Bob.
Awesome. Thank you so much for having me. I really appreciate it. Thanks, Mike.
Thanks,
Kevin.
Rick. Thanks,
Great.
Bob. Thanks, Mike. See ya.